How a DPT would treat low back muscle tightness. Low back pain is a very common condition, and in a lot of my patients, it's from tightness of the soft tissue structures. This is including the muscles, tendons, and ligaments. Now, the muscles of the low back, there are a lot of layers that surround the spine and help to support and protect your lumbar spine. But when those muscles get tight, they can cause difficulty with moving, with the mobility, and then some pain. So in this video, we're going to look at the most superficial or the top layer of muscles, and that includes the latissimus dorsi and the glutes. And those two muscles create this crossing X pattern in your low back, and they're connected by the thoracolumbar fascia. Now the thoracolumbar fascia is not a muscle, but it is a thick connective tissue that connects the muscles and provides support and stability for the lumbar spine. This is Garrett, and today we're going to treat his low back tightness. So when patients have tight lats, I like to start off with some soft tissue mobilization. I'll use my hands, sometimes a soft tissue mobilization instrument, to kind of work on the soft tissue, decrease the muscle tightness, and help the soft tissue mobility. So this is one of the instruments that I use. It has a nice beveled edge here, and I just kind of work over the muscles, and as I pass over the muscle, I can feel the areas of tightness. I can feel adhesions that have built up on the muscle, on the fascia, and we can kind of work to loosen that up. Once we identify the areas of tightness, then I can go ahead and perform the myofascial decompression, which a lot of people know as cupping, to the spots that I found to be tight. So I often use myofascial decompression to help decompress the soft tissue in the low back and alleviate some of that pressure on the patient's lumbar spine. And once we apply the cups, we always want to get the patient moving with a couple of stretches to get that muscle and that fascia gliding nicely. And then you bring your butt down, and you should feel the stretch through the low back. Okay, and then you're going to come back up, and then we're going to do that 5 times. Go all the way in, stretch it out. As you sink down, exhale, breathe out the air. Good, come back up. Now the next one, you're going to bring both hands to this corner of the bed. No, so both on the same side. There you go. And then you're going to sink down into the stretch. And we're really going to isolate the stretch on this side here. Can you feel that stretch?
Yes.
Okay, good. Same thing, we're going to come down all the way into it and then back up. And you're going to do that 5 times. Oh. So a little bit of suction. And now I'm going to glide the cup over the muscle and the fascia. Okay, very good. Flush out the area down towards the lymphatic ducts in the hips. Flush it out.
Yeah.
So after I work on the soft tissue and improve the soft tissue mobility, I like to come in and do a little passive range of motion for the patient, getting the hips, getting the low back moving. You feel a stretch?
Yes.
So now that we've mobilized the muscle and improved the soft tissue muscle tightness, what we're going to do is strengthen the lats. So here we're going to do a lat pull down exercise. Go ahead and pull down to engage the lats and build a little bit of strength. Good. As he pulls down, we go normal speed and then a slow and controlled rise back up to really get these lats engaged here. Good. So to strengthen the glutes, what we're going to do is an exercise called resisted sidestepping. So I placed a resistance band around the ankles, and now all we're going to do is take a step out to the side, and then step in, and take about 10 steps down in one direction. So you should be feeling these muscles in the hips, in the glutes, engaging as you have to pull that band out. So to end the session, we're going to teach him a glute stretch that he can do at home or at work to maintain that mobility between sessions. So to perform this stretch, you're going to start seated, and you're going to bring the leg that you want to stretch across and over the opposite leg. And then use your arms to kind of pull this towards the opposite shoulder in that diagonal pattern. And what you should feel is a nice big stretch through the glute there. You feel the stretch?
Do the stretch.
Okay, good. So the final stretch we're going to give him to go home with is a stretch for the lats. So to perform this stretch, you're going to need a doorway or a pole or something you can hold on to. You're going to stand about a foot away. This hand will come up, grab the door. This hand's going to come up and then reach over and grab. And what we should do is feel a nice big stretch down on this side. Feel a stretch?
Yes.
Okay, good. There you go. This way. Yep, good. And stretching all the lats through this back part here. Good. Okay, rest.